Hey everybody, Dr. Garcia and
Brookes, nice to see you.
From Contoura Facial Plastic Surgery, and today we wanted to talk a little bit about the non-surgical and the surgical options for treating the aging signs in the mid-face and the aging signs in the neck. And so we know that there's three major components to the aging face. There's skin issues due to loss of collagen, there's gravitational changes and drop and descent in certain directions, and then finally there's volume loss that occurs in the aging process. So I'm mostly going to focus on those last two. And when you look at the gravitational changes that occur, the mid-face is dropped down and in, and the neck has pulled apart, developing those two bands called the platysmal bands. And so what we're doing is trying to mitigate some of those changes through the non-surgical techniques that Brookes is going to talk to you about in just a little bit, and some of the surgical techniques that I'm going to talk to you about. So, Brookes.
All right, so if you've ever had a consult with me, I take a lot of wisdom from Dr. Garcia and I try to explain to you best I can about those aging components. So when I come to you with some of the solutions, it makes a little bit more sense why I'm choosing what I'm choosing. I use a mix of things. We use PDO threads, we use PRP, we use fillers and neurotoxins like Botox to address these different aging components. So as he talked about, and you're aging down and in with these gravitational issues, this is when I use interventions such as PDO threads to lift up and out to really address that gravitational component of aging. And I also use filler to complement it with the volume loss. I never try to hit the aging process with just one intervention because really we're doing an incomplete aging process. So with a little bit of patience and with a little understanding of why I'm choosing what I'm choosing, I will choose PDO threads and Botox in the neck to freeze and soften some of these bands, pull back on the platysmal bands that he was talking about, and then again, PDO threads, fillers to volumize the face, lift up with some gravity, pull back with some gravitational issues with PDO threads, and then adding some Botox to lift the brows. And that, with all of that said, the skin issue that he was talking about, a lot of the interventions that I'm doing with my PDO threads and with my PRP are also helping the skin portion of the aging process. So by marrying all those interventions, you can get really pretty results non-surgically.
Yeah, and that's really the ultimate goal, is you're trying to create a very natural appearing face, and how you get there is all dependent upon how involved a patient you would like to be in. So when you're looking at some of the more permanent changes that can occur with the surgical lifting techniques, you're really going opposite to the effects of aging. So if the face is dropped down and in, we're lifting up and out, and so we're putting tissues back where they used to be. And then with regards to the neck is pulled apart in the middle, so we're basically putting those bands back together and we're redraping the neck. Volumization is really is the heart of my practice, and that's putting volume back into the upper parts of the face so that we recreate that heart shape to the face, so that we're strong up here and we're narrow and defined as we move down into the jawline. So the ultimate goal, whether it's the non-surgical techniques that Brookes has outlined with fillers with or without PRP to build the face, the PDO threads in order to lift the face, or the neurotoxins in order to weaken certain muscular activities that create lines of the face, or the surgical techniques, which are more in a lifting capacity. The overall goal is so that our patients do look younger, refreshed, and they never really look like something was done. And so I encourage you to get onto our website at www.contoura.com and take a look around. There's a lot of information. It's a very rich website with information, lots of before and afters, and it shows a lot more information about Brookes' philosophy of treating the aging face and mine as well. So we look forward to seeing you in consultation, and should you have any further questions, you can always pick up the phone and contact one of us, and we'd be happy to talk to you. On behalf of Brookes and all of Contoura Facial Plastic Surgery, I hope you have a wonderful day. We'll see you soon.